spasm, facial muscle spasm. Okay, if like that, this is your rhesus sardonicus. Okay, this is one of the feature of our tetanus. Okay, another is opisthotonus. This one, arched back. You see, the patient is arched back behind. So this position is known as opisthotonus. Okay, dear. So these are the position. Okay, dear. Now, come when you will give the TT, when you will give the vaccine, and when you will give the immunoglobulin, right? This is the important thing that you should know. So you have to know about the wound type. In your question, you need to see what type of wound they have talked. Okay, so there could be 3 types of wound. It could be clean wound. Okay, it could be tetanus prone wound, and or it could be high risk tetanus wound, tetanus prone wound. So one is clean. What is clean? This is not penetrating, and this is very new wound, less than 6 hours. Somebody having a cut wound, less than 6 hours, he come to you, just a superficial, maybe deep, but not penetrated inside so much. Okay, so this is a clean wound. Okay, what is tetanus prone wound? Before finding out this, do the high risk. If you know the clean and high risk, the middle one are you will know. Okay, what are the high risk? If there is any heavy contamination with what? Soil or feces, manure or feces or soil. If there is heavy contamination, this is high risk. If there is wound and burn that is extensively devitalized tissue, extensively necrosed tissue, this is high risk. That much devitalized or necrosed tissue that you need actually surgical intervention. So any devitalized tissue extensively that needs surgical intervention or contaminated with soil or feces, this is high risk. And what is the clean? 6 hours, less than 6 hours, some clean wound, less than 6 hours, and there is not that much penetrating wound, this is clean wound. So what are the tetanus prone wound? This is the risky but not the high risk. This is the tetanus prone wound. What are these? If there is any kind of more than 6 hours, penetrating or puncture type of wound, any foreign body, any fracture, any sepsis, or any bites or scratch, all are tetanus prone wound. So if you remember the clean and the high risk, other than that, any kind of wound, tetanus prone wound. That's it. That's it. So remember the clean and the high risk. Remember the clean and the high risk. Okay. Now come why you should find out what type of wound is that, because for treatment, you need to know that. Now come with the treatment. I will show you. Last one. All the slides I'm showing, you will get it in your Google Drive. So don't worry, inshallah. This picture is not clear, not always clear. Even with nice guidelines, I couldn't get clearer picture than this. So this is enough to understand. So first come. Wait. This one I want. It's a preview I want. Just a minute, dear, just a minute. I need to download it first. It will be easier for you guys. Hope you can see. Let me maximize this one. Okay. This is the post-exposure management of tetanus prone wound. Okay, dear. See first, very concentrate very clearly. This is the last topic, dear, so don't lose your concentration. Okay, dear. See the wound name, clean wound, tetanus prone wound, high risk tetanus prone. So this classification just now I have told you, right? The type of wounds. Okay. Now come to the treatment. This box is about the treatment. After any cut wound, what you should give? The TT injection only, or both together, or only immunoglobulin? What you will give? Okay. This is the immediate treatment, and this immediate treatment only they want in your exam. Okay. This color. Okay. So remember, if patient is already clean wound, Okay, clean own, tetanus prone on, high risk on. This one, 3 types of own. Some immunization status also you should know. What are the immunization status? That patient already received all the preschool tetanus vaccine. There are 5 vaccines, right? 5 vaccines. The last, as I told you, 2, 3, 4, 5, and at the 18 years, right? So if somebody has all the vaccines and the last dose of the vaccines within the last 10 years, that means that 5 dose, any of the dose he took in the previous last 10 years, then your treatment would be different. Okay. Somebody who didn't receive it with any vaccine within the last 10 years, or never ever received any vaccine, okay, that one is the last stage. This is the last stage. Can you see? This is the one. Never received any kind of vaccine. Okay, this is the thing. And this one, the second table, this one is that they have received the vaccine, but it is more than 10 years. The time schedule already gone, but in his life, somehow he has got some vaccines. Okay, but he couldn't finish it, or the last dose is more than 10 years back. Then your treatment protocol should be different. Okay, so who has all the dose? This is the first this is the first one, dear. This is the first box. If somebody has already completed the vaccine and the not complete or completed or not completed, but the last dose is just within the last 10 years, then whatever the owned, you see here, no need of anything, no need of vaccine, no need of immunoglobulin. Is it clear? So anyone who has already vaccine in the last 10 years, he doesn't need anything, whatever the own type. Finish. This is the first thing. Okay. Number 2, already has a vaccine, but he already crossed the timing, or he didn't take the booster dose. So what should be his treatment? This is my second row of the treatment. If clean owned, nothing required. If it is tetanus prone, only there will be, you should give one tetanus vaccine. Only injection TT vaccine you will give. Okay. If high risk, you will give both together. That means you will give the vaccine and plus immunoglobulin. Okay, dear. Now come the last type of people who never ever going through any kind of vaccine. He is unvaccinated. He's not immunized at all. For him, if clean owned, you will give only the vaccine. If tetanus prone or high risk, both cases, you will give both together. That means the vaccine plus immunoglobulin, again, the vaccine plus immunoglobulin. Okay, how you will remember? This is like mixed up, right? How you will remember? It is very easy. Just let me, I'm sorry. Let me color it for you so you can remember. Let me color. First row, this one already I have somebody vaccinated, not less than 10 years, nothing, no need, go back home. You don't need anything. That's it. It is so easy to remember, right? The problem is these 2 groups. These 2 groups, if you divide 1, 2, 3, this is my 1 box. This is my 1 box. The other box is this 2. This is my number 2 box. This is my number 2 box. They need only vaccine. They need only vaccine. The green color only need vaccine. So 1 box, 2 box. Okay. Let me color pink, Barbie. This 3 box, this is number 1, this is number 2, this is number 3. All these 3 box containing both together. TT plus vaccine plus immunoglobulin, vaccine plus immunoglobulin. So 1 box, 2 box, 3 box. That's it. That's it. Your treatment finish. Okay, if you can remember this picture, nobody will give it a wrong answer. Is it clear? I want answer, dear. Is it clear?
Thank you, doctor.
Okay, that's it. That's it about our today's session. Alhamdulillah. It took time, but Alhamdulillah, I have finished my lines. I mean, the finishing line. Thank you so much, everyone. Next day, it will be a longer duration, obviously, 3 hours or 4 hours to finish all the other topics of infectious. Inshallah, we will finish. Thank you. Thank you, everyone. Have a very good sleep.
Thank you.
Welcome, dear.
Jazakallah.
Welcome, dear. Welcome. Just keep me in your prayers. Welcome, Dr. Abby. Welcome, Dr. Aruz. Thank you. Thank you, everyone. So let's have a good sleep. Okay. Assalamu alaikum.